Hi, I'm here with Dr. Reginald Coopwood, CEO of Regional One Health. Would you tell us a little bit about Regional One Health?
Regional One Health is a kind of a historically safety net hospital in this community. We take care of a lot of the vulnerable patients, high acuity patients in trauma, burn, high risk OB.
We see a lot of patients on a daily basis, usually the sicker patients for this area. We're the only level 1 trauma center, burn center, and high risk OB center in 150 miles in any direction.
You were talking about a journey that you've been on. Can you take us on a little bit of that journey?
When I joined here, I was basically tasked with make this organization thirsty for data. If you take our journey and fast track it, that's essentially what we want to help hospitals do now.
We have taken what we've done here at Regional One Health with our Domo use cases and packaged them into an app that basically rolls up 16 key performance indicators that we feel are data-proven points for the healthcare industry.
Domo is very important when I think about nurse staffing. We have a matrix to determine how many nurses we need, so we use Domo to help us see where our opportunities are.
You had mentioned length of stay was something that really is top of mind for you and your department. Can you comment on that metric?
Length of stay helps us to monitor the patient days, making sure that the patient get along the care continuum in an effective and a timely manner.
I think what's been really fun about Domo is it's given us the ability to really give frontline managers the ability to make data-driven decisions.
Our VP of Pharmacy really needed to grow the amount of pharmacy prescriptions that were completed in-house instead of them going to outside pharmacies. And when the project started, they had about a 33% average use of internal prescriptions. And now it has grown to a 60% growth.
Being able to daily see how we were making an impact and see the trend lines to see what we needed to continue to do to be able to make up gaps, or if we were overperforming, what that meant for the rest of the year, and seeing those trajectories. Giving them managers that information was so inspiring to help them stay committed and motivated. It ended up adding $6 million to our bottom line at the end of the year.
We use the data mainly to see how our patients move through the system. If we find roadblocks or other things like that that are affecting patient care, then the Domo data set gives us an ability to identify those things in real time.
And so you've effectively created a single source of truth from anyone from the CEO down to a frontline worker to be able to see what they need to be able to act on it.
Absolutely, and the great thing about this application is, again, we've talked to different people to see what level of data do you need to see in order for you to make the best decision. So some of the cards are just gauges, they just show a quick number in red or green, and then you have some that show trend information. You click down one level and it shows the breakdown by clinical departments or by leader. We've really done that legwork based on what's worked for us in our hospital to recommend what might work for others.
And as you look to the future and where emergency medicine is going, how do you see this playing out over time?
We want to make sure that each patient is viewed not as a series of numbers, but they actually get the care that they need. But to do that, we have to optimize the system. Looking how they move through the hospital, through laboratory, through radiology, through special procedures.
To get the whole picture.
Absolutely. And so once we kind of tie each of those departments into the data set, we'll actually have a full picture of how the patient comes into the hospital, works their way through, and then ultimately leaves.
So, doctor, what's next? Where do we go from here?
Our goal is to see how do we share it with the world, and how do we take the kind of the blood, sweat, and tears that we did and the trial and error that we did in building what we have today in the dashboards, so that other organizations don't have to have that same journey. We've had success in this year, and I don't think we would have been there without the tool that we developed with Domo.